Hello, we're going to talk about taking an ideal alginate impression. Pam?
Okay, first you place Vaseline on the patient's mouth. Open, Bo. Open. There we go. We'll get it on the corners here. And then you want to Vaseline your cheek retractor. Then you want to place your cheek retractor in. Is that comfortable for you?
Mm-hmm.
Okay. Now you want to fit your size tray. And it fits everywhere. And you want to fit your lower. Is that okay, Bo? Lift your tongue up for me. You're good. All right.
Now you're going to spray.
Spray the back of their throat to help any gag reflex. And stay open right there, Bo. Now you're going to spray your trays with a separator spray. And you're going to fill these with water. Each vial is for one arch. And we always put a flavoring in there. And we use 3 level scoops. And you want to get it all mixed up. And then you're going to bring your mixer up. You're going to put your tip down in the mix and turn it. And push down. I always take the upper first. And I take the palate off. Now, take a deep breath and hold it. Now I'm going to place some on the occlusal surfaces. Now take a deep breath and hold it.
It's very important that you wipe it on the occlusal surfaces or you'll get air bubbles on the surfaces of the teeth.
Just breathe through your nose.
It's also very important that you put the retractors in. Some people can just pull the lip out. You don't want to just put the impression in the patient's mouth without retracting the lips or you won't capture the vestibule. So the best is to use these double retractors, and that gets the lips out of the way so you can capture the vestibule. Okay, so we leave this for
It's already
2
set.
minutes.
I mean, it's a fast
You usually set a timer.
3 minutes, or as soon as the material is set.
Okay, so we've set a timer back here for 3 minutes. And just have the patient breathe through their nose. And this is a trick you might try that a psychologist patient of ours told us. If you do your thumbs like this and hold it on both hands, that's supposed to help with the gag reflex. The main thing is breathe through your nose. Don't breathe through the mouth. And if somebody has a gag issue, tip them up in the chair. So 3 minutes is up. And you take it out with your finger in the back of the tray and push down on the back of the tray. Okay. You can see that captured the vestibule. We don't have any air bubbles on the teeth. That's going to be a beautiful model. Just remember, if you send a crummy looking model to your dental laboratory or to any other professional person you're working with, they're going to judge you on those models. So you want the model to be, number 1, accurate, but number 2, well trimmed and on a base, those types of things. So that's a very accurate upper impression. Now let's take the lower. So once you take an alginate impression, if you're not going to pour it immediately, wet a paper towel and just put this around it to keep it in 100% humidity until you pour it. Yeah, put it in a Ziploc bag. And you want to pour this within probably
an hour or two.
You don't want to let it sit around for a day, because if it dries out, it's going to distort. Okay, shall we do the bottom?
Open both. We're going to put this on the occlusal surfaces.
You push that hard into the occlusal surfaces so you don't get any air bubbles.
Open. Now lift your tongue up, Bo.
See, and this retractor gets the lip out of the way so you capture the vestibule. Be sure the tray does not lift up. If you put the tray to place and it lifts up, you're not going to get a good impression. It's going to be distorted, and you're going to have a lot of air underneath it. So once you push it to place, be sure you hold it at that terminal position. Don't let it lift up. We've got a timer set over here for 3 minutes. You'll tell the patient as we were talking with the upper impression, tell them to breathe through their nose, sit them up. Normally, people don't gag with a lower impression like they do with an upper. So we normally take the upper first. Then spraying the palate with this Hurricane topical spray. Do y'all find that's a big...
And under the tongue.
Yeah, and under the tongue, okay. And then suction it out. Don't just leave it in there because it doesn't taste so good.
Even though it feels like it's hard, go ahead and let it set.
Yeah, don't judge. Don't just wing it with the time.
And it's not going to move, but just let it set for the full 3 minutes.
Just remember, if you can't take a good impression and pour a good model, you can mess up a whole morning's work, because that's all the laboratory technician has. If you don't measure the powder in the stone that you're pouring your model with, that can cause the stone to shrink or contract a certain amount. So the manufacturer has a specific amount of water and stone to mix together to get just the right shrinkage, contraction, and expansion so that it's an accurate model. So go by the directions. We'll show you how to do that in another video here in a minute. You don't just want to slop water and powder into a bowl and mix it up. It's very important you have a mechanical mixer so you can get the air out of the stone as you mix it. If you've got a bunch of voids in the stone, that's not good. Okay, so when she takes this out, she's going to put her...
that tray with your tongue, Bo, and push straight up.
And she's going way back to the back of the tray.
Straight up with your tongue.
And
there you go.
Popping it loose. Okay, see, we've got a great vestibule. No voids in the occlusal surface of the teeth. That's a fabulous impression. You have a big piece hanging off the back end of the model. Be sure you cut that off. See, like these? Cut that part off so when you set it down, it doesn't lift the impression material off the tray, out of the tray. So wrap this with a wet paper towel until you're ready to pour it, and you really want to pour it within probably 30 minutes or an hour. Water temperature can affect the model, so that's how to take excellent alginate impression.